Every year in Canada, millions of doses of injectable medications are administered to patients in hospitals or other healthcare settings. Ideally, the drugs they receive are commercially available in a ready-to-administer format at the correct dose for each patient. But this is not the case for the vast majority of the drugs. In the second-best scenario, pharmacy staff prepare appropriate doses of medication in a ready-to-administer format using commercially available drugs, specialized processes and equipment, and in a clean room, all designed specifically to help keep sterile drugs sterile. Some compounding may appear to be a simple task, but it is not. Compounding can be very complex, particularly when a drug must be sterile, as is the case when the drug will be injected. Compounding becomes even more complicated when drugs from more than one container are combined to make a preparation, when compounding involves hazardous drugs, such as chemotherapy, when the drug will be administered via an intrathecal route, or administered to patients whose immune system is very fragile, such as the critically ill, neonates, or patients with cancer. However, the risks associated with a drug increase when the preparation becomes contaminated or is made with a non-sterile ingredient. In these cases, the preparation must be sterilized before it is administered. Like precision timing, high-quality compounding doesn't just happen. It is based on good science and quality management, and is shaped by people, processes, supplies, and the physical environment. Hospital and pharmacy staff must work in a highly reliable, accurate manner to consistently ensure that patients receive the intended benefit of the medication, and to protect healthcare staff from unintended harm caused by exposure to the drug. How can we improve? Develop a keen awareness of how risks enter processes. Continually learn how to improve according to a series of validated processes. Routine assessment of skills and knowledge, followed by continuing education, is also needed. Do not assume no news is good news. Just because a problem hasn't occurred yet doesn't mean it won't. People need to recognize risks of all types, report them, and take corrective action. Pay attention to the signals indicating that the processes are working correctly. Routinely test procedures to assess whether the processes are working as intended. Implement an environmental monitoring plan. Listen for the signals that something is not right. Even the ones that may seem trivial. Do not assume a patient's adverse reactions are unrelated to a compounded preparation. Determine the root cause of an issue. Don't just think it, speak up. Stop the line. Learn about best practice guidelines and standards. Continually assess your practice against those guidelines and standards. Listen to the signals and speak up. If you don't do this for your patients, who will?